Welcome to 10-Minute Health Tech, the AI-powered podcast where we dive into healthcare technologies and companies so you don't have to. I'm Anthony.
And I'm Julia.
Today, we're going to be looking at Ada,
Okay.
an app that uses AI to assess your symptoms. They've got millions of users, and they claim to be optimized by real doctors.
Mm-hmm.
So it's not just some algorithm running wild out there.
Right, and that's what makes Ada so interesting, is they're trying to bridge that gap between AI and human expertise in healthcare.
Yeah, for sure. Okay, let's unpack this a little bit. So what exactly does Ada do? I mean, is it just a glorified symptom checker?
Well, I think it's much more than that. Ada acts as a digital health companion,
Okay.
and it walks you through a detailed assessment of your symptoms. So imagine kind of like a virtual doctor in your pocket.
Okay.
But instead of just giving you a list of possible conditions, it actually guides you on what to do next.
So it's not just about diagnosis, but also about guiding users towards the appropriate action.
Exactly. Ada helps you understand your symptoms, suggests potential causes, and advises on next steps, whether that's self-care, seeing a doctor, or something else.
Wow.
It even offers guidance in multiple languages, making it accessible to a wider audience.
Oh, that's pretty impressive.
Yeah.
But how does it actually work? Like, does it use some kind of super smart AI or something?
Well, Ada's AI is based on machine learning, which means it learns from vast amounts of medical data.
Okay.
But what's unique is that this data isn't just fed into an algorithm and left alone.
Yeah.
Ada has a team of clinicians who constantly refine and optimize the system, ensuring its accuracy and reliability.
So they're combining the power of AI with the experience of actual doctors.
Precisely. And that's reflected in their EU MDR Class 3 certification, which is a pretty big deal in the medical device world.
Okay.
Shows they're serious about meeting strict medical standards.
Yeah.
But it's one thing to have certifications, it's another to actually help people.
Yeah, for sure.
So what are users saying about Ada?
That's a good point.
Mm-hmm.
Are there any real-world success stories, people whose lives have been impacted by using this app?
Yeah, we found some pretty compelling user testimonials.
Okay.
One person said Ada helped them finally get treatment for a condition that had been misdiagnosed for years.
Oh, wow.
Another user said Ada correctly identified a rare disease they were suffering from.
Wow.
And someone even shared that Ada helped them figure out they had a busted eardrum, which they hadn't even considered.
Those are some powerful stories.
Yeah.
It sounds like Ada's making a real difference in people's lives.
It seems so. Of course, we should remember these are individual experiences,
Right,
and not claims made by Ada itself. But they do highlight the potential of AI to impact healthcare positively.
Absolutely. So who are the brains behind this operation? Who makes up the Ada team?
Well, Ada's leadership team includes people with backgrounds in both technology and healthcare.
Okay.
Their co-founder is also their chief medical officer.
Okay.
And they have a whole team of medical professionals, like an SVP of medical product, a director of medical quality, and several medical product leads and specialists. So it seems they've got both the tech and the medical expertise covered.
That's good to know. It's reassuring to see that medical professionals are deeply involved in Ada's development and operation. It gives me more confidence in their approach.
Definitely. It seems like they're not just throwing an algorithm out there and hoping for the best. They're really trying to integrate AI into healthcare in a responsible and effective way.
Okay, so we've learned that Ada is this AI-powered app that helps you figure out what's going on with your health and guides you on what to do next. It's developed with input from clinicians, has some impressive certifications, and boasts some pretty positive user feedback. But where does Ada fit into the bigger picture of healthcare? What's the overall significance of what they're doing?
Ada is part of a larger trend of using AI to make healthcare more accessible and personalized. Think about it. We carry powerful computers in our pockets, but accessing quality medical information can still be a hassle.
Right.
Ada's trying to change that.
That's a great point. It's like having a medical expert available 24/7, which could be a game changer.
Yeah.
Especially for people in remote areas or with limited access to healthcare.
Exactly. And Ada isn't just for individuals. They also offer enterprise solutions,
Oh, okay.
partnering with hospitals, clinics, and even insurance companies.
So how does that work? Are they trying to replace doctors with AI?
Not at all. Ada's enterprise solutions are more about supporting healthcare systems,
Okay.
not replacing human professionals.
Okay.
For instance, Ada can help streamline triage processes, so patients are directed to the most appropriate level of care more efficiently. This can be especially helpful in busy emergency rooms or understaffed clinics.
That makes sense. So instead of replacing doctors, they're helping them be more effective.
Right.
And I remember reading that Ada played a role in pandemic
Huh.
response, right?
Yeah, during the COVID-19 pandemic,
Mm-hmm.
ADA was used to provide accurate information and guidance to the public. Think about all the confusion and anxiety at the time.
Mm-hmm.
People were desperate for reliable information.
Right.
ADA helped alleviate some of the strain on healthcare systems by providing quick, trustworthy answers to common questions.
It's amazing how AI can be used to address urgent healthcare needs on such a large scale. It makes you wonder what other potential applications are out there.
Absolutely. And that brings us back to the bigger picture. ADA is just one example of how AI is transforming healthcare,
Yeah,
making it more accessible, efficient, and personalized.
it really is.
It's an exciting time to be following this space, but it also raises some important questions.
Like what? What are some of the things we should be thinking about as AI becomes more integrated into healthcare?
Well, one big question is how comfortable are we with relying on AI for medical guidance?
Right.
I mean, it's one thing to use an app to check your symptoms, but what about more serious health concerns? Where do we draw the line?
That's a really important point.
Yeah.
And even if the technology is accurate, there's the question of trust. Can we really trust an algorithm with something as important as our health?
And on the flip side, if we become too reliant on AI, what happens to the doctor-patient relationship?
Right.
There's a human element to healthcare that's crucial for building trust and understanding.
You're right. It's not just about cold, hard data. There's a lot to consider. So, what does this all mean for the average person? What should our listeners be thinking about as they navigate their own healthcare journeys in this increasingly digital world?
I think the takeaway here is that AI is really changing the healthcare landscape and it's happening fast. Like, apps like Ada are just the tip of the iceberg.
Right. We're seeing more and more digital health solutions popping up,
Yeah.
offering everything from virtual consultations to personalized treatment plans. It's an exciting time, but
Yeah.
it also demands a healthy dose of caution and critical thinking.
Absolutely. We can't just blindly embrace every new technology that comes along.
Right. We need to ask questions, weigh the benefits and risks, and consider the broader implications.
Exactly. Like we've been discussing, how comfortable are WE with relying on AI for medical advice?
Right.
What role do we want AI to play in our own healthcare journeys? These are questions each of us needs to grapple with.
Yeah. And it's not just about individual choices, right?
Yeah.
There are also societal implications we need to consider.
Yeah.
Things like data privacy, algorithmic bias, and access to these technologies. These are conversations we need to be having as a society.
Absolutely. AI has the potential to revolutionize healthcare,
Yeah.
but we need to ensure it's done ethically and responsibly with everyone's best interests in mind.
So where do we go from here? What's the next step for someone who's been listening to this and thinking, wow, this AI stuff is really changing things?
Well, I think the first step is to stay informed.
Yeah.
Read about these technologies, follow the developments, and engage in conversations about the future of healthcare. The more we understand, the better equipped we'll be to navigate this new landscape.
And don't be afraid to ask questions.
Yeah.
Talk to your doctor, do your own research, and form your own opinions about how AI should be used in healthcare.
Exactly.
This is a conversation that affects all of us.
I think that's a great note to end on. AI in healthcare is a complex and evolving topic,
Mm-hmm.
and there are no easy answers.
So sure.
But by staying informed, asking questions, and engaging in thoughtful discussion, we can help shape the future of healthcare in a way that benefits everyone.
Thanks for spending 10 minutes with us, and be sure to look for more 10-Minute Health Tech podcasts.
Bye.
Bye.